Welcome to the Repro Files, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Repro Files.
Infertility, injustice, and all things nobody warned you about.
Welcome back to the Repro Files. I am Elizabeth Lee, nurse, advocate, crime scholar, lover of all things coffee. And this week is a huge one because we are headed, AnnMarie and I are headed off to the ASRM Scientific Congress in San Antonio, Texas this weekend.
Hey, that's right. We're so excited because next week's episode is coming to you live from Texas, our first in-person recording together. It's going to be amazing to be in the same room as you to do this podcast.
Yay.
But first, we need to talk about some news that's been going on in our field. Like, did you hear about this, Elizabeth?
I feel like you're Julie Chen on Big Brother when she goes, but first. If you're not a Big Brother fan, you don't understand. But that is like, every time she says it, they do a hashtag. You are right, though. But first, before we dive in, yes, there was a big announcement from this past Thursday. As we've discussed previously on this show that the president made a campaign promise back in August of 2024 that the government or insurance companies would pay for fertility treatment. And many people voted for him because of that very campaign promise. And the fact is that infertility impacts 1 in 6 people worldwide, and fertility treatment varies in cost and access based on your zip codes, right? And some insurance companies cover treatment. Then they have some that are supplemental insurance companies, but your company needs to offer these supplemental insurances to be able to take advantage of them. And since not all states have a mandate and the ones that do vary, it's a pretty complicated web. And I think the overarching feedback I've heard from others in the field has been like, it's still not clear exactly what the plan is, right? It still feels like a lot of performative and not as much brass tacks.
Yeah, there's definitely clarification that is needed. So we had a campaign promise, and then in February of this year, Trump signed an executive order that gave the policy advisors 90 days to come up with a plan to expand access and to reduce the cost of IVF and other fertility treatments. As we have mentioned in a previous episode, if you haven't listened to that one, go back and visit it. But that 90 days came and went in May, exactly on Federal Advocacy Day, which we both participated. And then after that, it was just crickets, like literally crickets. Nothing happened. And then all of a sudden, restorative reproductive medicine came into the mix, and it was all about RRM and, oh, this is a great idea. And then we got this surprising announcement on October 16th, last Thursday. The announcement basically were two basic things. Number one, the new federal guidance allows supplemental pre-tax insurance plans to cover fertility treatments. And number two, EMD Serrano will offer discounts of up to 73% on their fertility medications, which include Gonal-f, Cetrotide, and Ovidril. And I was in the car during this whole thing that was going down. So Elizabeth called me, and she was literally holding the phone close to her TV so that I could hear what was happening as I was driving. And once again, she was my play-by-play announcer.
Happy to be your play-by-play political advisor, my friend. But yeah, let's totally dive into that news a little bit, because I will say on the front end, number one, this is moving the needle. Okay. So like you mentioned, we've been kind of all over the board in terms of what is the real kind of bottom line end goal. And then what are these things in the middle that sometimes I think are nothing more than a distraction, right? So we can't dismiss the fact that fertility is in the news, and that is a good thing. It is a good thing. It has been a secret club for so long, and it's now getting media coverage. And we're here to make sure that you, dear listeners, understand the ins and outs and not just the sensational news part. And then number two, any progress in covering or making fertility treatments cheaper is positive, period. And end of story. Is it what was promised? It's not. And that's where we do need to state that it's a step in the right direction, but the details really matter here because I think, again, backroom conversations amongst those of us in policy wonks in the field. So, I mean, not policy wonks, but those of us who are nerdy enough to sort of dive into the details, a number of us noted the same thing. And that was there was a couple of times it was said like, and for those who are eligible, and for those who are eligible. And so the question is, you know, who will be included? Who will not be included? Because what was discussed was not a mandate. It was not a basically insurance is going to pay for IVF. Because as we said, that was the campaign promise. And folks delayed treatment, literally waiting on that to be the outcome. And we've just kept sputtering to the next phase and getting like enough to be like, okay, we're not going to deny, not a single one of us is going to deny that the fact that this is in the news is great. But I feel like those details matter.
Can't agree with you more. I remember speaking with a patient earlier this year. It was a couple, I was doing a med teach for them. And I remember the gentleman was just like, what happened to that promise that IVF was going to be covered and all of this? I'm like, well, there's also an executive order. That was back when it was still in play. But I could feel the frustration that he was having because he was just frustrated with the whole process, which is totally understandable and what most fertility patients go through. So, let's break it down a little bit. This is a guidance that allows companies to offer fertility benefits. Think of it like your dental and your vision plans. And for some reason, I never understood, but eyes and teeth are not part of your medical insurance. I don't know who decided that back in the day, but you have medical insurance, but then you also need dental and vision. And usually
And
they're
now
packaged
fertility.
together, right? Yeah,
Yeah,
it's really bizarre.
yeah,
I
you need
don't
yeah, so
understand.
your eyes don't count, your teeth don't count, and your reproductive parts don't count. Okay.
Yeah.
Check.
So, but my first response hearing this through the telephone on your TV was basically, we already have supplemental insurances for fertility. There are companies out there that offer supplemental insurances for fertility. It's up to yeah, parent. Yeah, it's up to the company to offer it to their employees. Like Progeny and Carrot, they have representatives going out there trying to get people to sign up. And usually, from my understanding and from my experience with progeny patients and carrot patients that I've worked with, is that they pay the entire what's the word
Premium?
I'm looking for? That's insurance. Thank you. Premium. Yes.
So there's no cost sharing with the premium.
Correct. Yes. So, but here's the thing, companies with this announcement, companies are not required to offer fertility benefits either. So is this really new? Is this all like new?
Yeah, and that's gosh, that it really is. It seems like that is the sentiment. And I think we can't be clear enough in saying how positive it is that especially in the midst of a very strange political time. It is a good thing for people in our, do what we do and care about people having families. It is a good thing to have it on the national stage. But this announcement doesn't include any new funding at all for patients or providers. So there's number one. So there's no new funding for patients to get again if I go and this is part of the problem in our country is that our medical benefits or lack thereof are tied to our job,
Mhm.
right? So, we have tons of folks that stay in jobs that they hate or go leave jobs they love and go work jobs they don't in order to get
Mhm.
medical benefits. In the richest country in the world, are we serious? So we don't have any new funding for patients or providers. It's not a mandate. A mandate would require insurers to cover treatment. By the way, mandated states do wonderful with this. And I know you and I have both been very envious. Well, you once did live in a mandated state, so lucky
I
you.
did
But
live in a mandated state.
yeah,
It never even crossed my mind until I moved.
yeah, yeah. And so then you mentioned EMD Serono. EMD Serono is a large pharmaceutical company that manufactures a number of the key drugs, the injectable medications that are used for fertility cycles. And by the way, that's not just IVF cycles. Those drugs are often used for IUI cycles as well and timed intercourse cycles.
Mhm.
So these meds are fertility meds, are not IVF meds. But EMD Serono is reportedly joining Trump RX, which allows people to buy their medications direct to consumer, so directly from the manufacturer. starting in January of this coming year. That's there through that platform, they've agreed to offer their medication at a discounted rate. So somewhere between 42 and 79% discounts. And that is a big deal. That's huge. Okay. It's huge.
It's
I
gonna be
do want
huge.
I do want to add that they have mentioned, quote, for those who qualify. I think it was mentioned at one point, like based on financial need. And I want to point out that EMD Serono already, or actually rather, let me back up. It may not be EMD Serono, but there are already two key, I think it is by Serono, two key fertility med discount programs that are income based. One was called at one time Compassionate Care. I can't remember. I know I want to say they changed the name. And then Reunite RX, that's Merck's group that helps get discounted meds. So, I mean, as a standard part of my work as a fertility nurse, I was always giving out information and teaching people how to go seek those discounts. I worked at one of the most affordable clinics on the West Coast at the time. We built that together on that premise that it should be affordable. And we had many of our patients who would apply for that program and get 75% off. So again, amazing to have a discount. The FDA is also going to expedite one of EMD Serono's European fertility drugs, Pergoveris, which is another interesting piece because, patients for many years have had to go outside the country to get their fertility meds because that was the only way that they could afford them, right? So there's a lot of interesting pieces to unravel.
Yeah, it is. Yeah, and again, still working through all of the details. I think things are going to be coming out to get more of an understanding, more clarity, things like that. I want to take the conversation a little bit different direction right now because, Trump was asked about what the conservative views are because a lot of conservative views, and I'm not saying a lot, I'm not saying everybody, but there are conservative views out there that are anti-IVF. Trump stated that he wasn't aware of this, which is kind of weird because I don't know, Alabama, it's been, he
It's
also
been pretty
stated
clear.
that, yeah, right. I mean, if you don't know about that, then where you been? But he did say that this was pro-life, but it seems that the pro-lifers are not very happy with this decision. As a matter of fact, Live Action, an anti-abortion group, their leader stated on X that, quote, IVF kills more babies than abortion, unquote. Like that's a pretty serious thing to say. Others in Make America Healthy or MAHA have said that IVF is unnatural and an insufficient solution that has been pushed by the pharmaceutical industry. So, Elizabeth, what are your thoughts on these takes?
Again, it feels like we're on like some sort of odd Ferris wheel ride or something because yeah, because we, having been on the Hill just last month, and attending these briefings on restorative reproductive medicine and on this group that whilst on the, at front they said this is not anti-IVF, you look up each and every one of them and they say things exactly as you've said that, IVF is unnatural and it's an insufficient solution pushed by the pharmaceutical industry. And then the next thing you know, we've got the pharmaceutical industry partnering with this administration to say we should do more IVF. It's like, I do. Like, I don't like fair rides, and this feels like that. There's a slightly nerdy moment here, but I love the artist John Mayer. He's a wonderful guitarist, and he's got this song called Stop This Train. I want to get off and go home again. That's essentially the refrain of the song. And sometimes when things have been very tough, I've been like, let's stop this train. I want to get off and go home again. And that's kind of how this feels because at the end of the day, you and I both see the same end point, which is more patients delaying their care on these promises that on their face look wonderfully positive. And on their face, we will work together with anybody to make IVF more affordable and more accessible, period, full stop. If the Heritage Foundation approached ASRM today and said, you know what, we were wrong, people should really have clear, open access to all of the RRM stuff, but we're not, we will support IVF. I mean, can you imagine the synergy that would form, right?
Yeah.
But it's not because they're just all of these, the devil's in the details. And there's a lot of black spots when it comes to the details. It feels like we got a report that was like 98% redacted. So you were like, okay, you're like looking at these pieces, but still kind of like, if you ask me to write down like what the plan is, I don't feel like it's clear.
Yeah. Absolutely. I felt the same way. I'm just kind of like, okay, I get it, but I don't. I just want more. Lastly on this subject, before we move on to our part two of this episode, is, Elizabeth, we have been advocates and we've been on the Hill and we have seen Senator Duckworth's bill be shot down
Yeah,
twice now. And we were
twice.
present for I was present. I don't know if you were there for the second one, but I was the present, we were together, obviously, but I haven't heard much from the people who voted that down. Like, do they support this? Do they not support this? Where are you, senators? I want to hear from you. I want to hear your take on this. And if you support this, what was the why? I guess the question is, why should, vote that down? Is it because it was the mandate? Is it because this is just a screen of like, yeah, we're just going to say we're going to offer this great stuff, but it's not really mandated? Is that the issue? And that's what I want to hear from our senators who voted this down.
Absolutely. That is exactly what we do need to hear because, again, we're out here left going like, what is actually the plan? And so, yeah, we would love to hear from you all.
Yeah. All right. So I think we've come down to the end of like this still needs to be analyzed, and we need to see how this is all going to shake out. So now we're going to switch lanes. So
Yes, please.
as we always do, as our pivot moment, we always have pivot moments when things come up in the news. But, our topic today is we will be we're going to be at ASRM next week. We're going to talk a little bit about Elizabeth's white paper that she's going to presenting at ASRM. It's called Defending the Science of Reproductive Medicine. Tell us more.
Yeah, no, it's part research, part reality check, and honestly, it is the most urgent conversation that our field needs now. Right now, while we're all together convened in one place, right? We need to address this. And for decades, this field has been defined by innovation and by clinical excellence like I've never seen before.
Hmm.
But right now, we are truly facing the perfect storm of economic, ideological, and misinformation. All of these things are threats that are endangering patients' access once first and foremost. And that has already been such a haul to increase access. And these threats really endanger that access. And they also endanger our professional autonomy.
Yeah, I think we feel that every day in clinics, and patients are confused, they're scared, and sometimes misinformation. They've never before they've even met us. They've have all this misinformation going on in their heads.
Yeah, absolutely. I mean, at the end of the day, the cost of care is crushing. It has been, it continues to be crushing. And with misinformation spreading way faster than actual evidence, we talked about this, I think, last week. This idea that statistics and research is really, really, really hard. And what sense does it make? I mean, when we know that the average reading level of our populace in the United States is at a sixth grade level if you average it out. I'm not entirely sure why we would expect actual evidence to spread faster than misinformation when, to be truthful with you, we haven't really, from a messaging standpoint, done that great of a job, right? Because we have tried to keep it very scientific, very evidential, and that doesn't always connect as well as we would like it to, right? So cost is crushing families, misinformation is spreading, and lawmakers are trying to legislate embryos. Many lawmakers, their focus is let me legislate these embryos instead of listening to science and actually legislating and making and putting forth and getting legislation passed that would once and for all make this access more available, right?
Yeah.
It's just not just about fertility in my mind anymore. And I think that the fall of Dobbs, and I think really the Trump era in general has sort of been, if you recall from Trump 1.0, we had what was called alternative facts.
Hmm.
If you recall when the EPA was getting funding slashed and Kellyanne Conway said, "Oh, well, what do you say to that? Oh, well, those are alternative facts." Right. So, this isn't anymore just about fertility. It's truly about defending truth itself.
Yeah. Well, I think that, every person in Congress, the president, everybody, they need to have maybe one of us experts in the field being right there next to them, explain to them what exactly that is. Going back to your, talking about embryos and legislating on embryos, I don't think they understand the process enough to make decisions for people that
Yeah.
they represent.
Well,
So,
one of our colleagues who we'll be seeing this weekend and next week, which we're so excited, but one of our colleagues, Morgan Baker, she's an absolute incredible nurse, a fertility nurse, just amazing advocate. She was part of the first inaugural year of the primed cohort that we did with the policy fellowship. So Morgan, after I want to say after those promises, those campaign promises were made, I want to say last year, at some point, Morgan and her team got legislators to come to their clinic.
yeah,
Like
they did. They
let's see
visited.
how it's done, right?
Yeah.
Because we have been offering we've mentioned this in prior episodes, like we've been offering our services basically pro bono to the government. Like we want to help solve this problem. Like, you know what I
Yes.
mean? And so, yeah, so it feels like, and I think that it's interesting that this episode has sort of gone in this direction because it feels like this sort of start, stop. And, yeah.
Mhm.
And so it's really now about defending just what is actual fact and what is true.
I mean, I think that's what we all need. I mean, we all need to be out there being our the experts to the representatives and everywhere. So you've been talking about affordability for years, especially through the congressional testimony that you wrote last year. What's changed since then?
You know, I've really been, affordability has been my number one thing in this whole field. Coming from means that would have never allowed my family to do IVF. I understand that cost is a critical component to whether or not people make it through the finish line. And so what started as a cost crisis and has been a cost crisis for a while is now a cost and a credibility crisis because in 2024, fertility medications made up close to half of the cost of one IVF cycle is just the medications. Now, I want you to think about that because I want you to think about if you don't have the familiarity in your head, go Google like IVF lab or IVF clinic and look on images and just like look around. Because we, as the industry, the providers, and many people in the industry, we've done a really good job at attacking this cost crisis, right? And trying to drive the cost of care down. But almost nothing has changed. So, generic inotropins, so some of those fertility medications are still stalled. You've got biosimilars that are tangled up in red tape. And that was a lot of what my congressional testimony was aimed to do, was to shed light on the fact that there is a lot of red tape and exclusivity rules that protect profits and not patients. And that's not calling any one or thing out. That's just fact, right? Is we have gonadotropins have been used for IVF forever, and yet they're still mostly only available at what would be like brand name prices.
Yeah, I mean, I know that there are some generics out there, and they're starting to come through. I know Mihal is one of them that it's working on generic fertility medications. They do have, I think, or two out actually right now, working on that. And I think that's going to be very helpful. But basically, with these medications being priced at where they are, it means like everyday people like teachers, nurses, ourselves, veterans, we're being priced out of parenthood.
Yeah, absolutely. And that honestly, that's why this field has meant so much to me because I think about the people that I've served in the fertility world over these years and, teachers who would, have to try to plan to do IVF in the summer and then wait and do their transfer a little later so that their baby would be born in the summer because then there would be no other way they could make it work. Or nurses
Hmm.
who, a lot of nurses work 3 12-hour shifts. And those shifts, there's no leaving the premises for those 12 hours. So if your monitoring falls on one of those days, or the pharmacy tries to call one of those days to set up your delivery, and you're in a dead zone in the hospital, caring for a patient, and that becomes really difficult to manage that or to even get time off for these things. Or veterans who, I think about our military and our veteran families, AnnMarie, and when you think about a lot of clinics have a significant wait list, right? Because there's still a problem with supply and demand. We have much bigger demand than we have supply, which means people
Hmm.
wait. Now, what happens when you go through IVF, you make an embryo, you're ready to do your transfer, and then your partner gets orders that you're stationed somewhere else in a week? And, and I know an amazing advocate for military and veterans families, Julie Eshelman, who has just been such a beautiful advocate for that perspective of like to go through all of that and then, and when that comes up, it's always the cost is the primary limiting factor. And so, and then when costs climb, misinformation explodes because people are looking for, I think, people are going to a clinic and somebody's saying, well, you need to do IVF. And listen, no single provider can say the only way you're ever going to have a baby is IVF. So, I mean, that's not true because I guess like if you don't have tubes or there's okay, but this idea that like one doctor can tell you with certainty whether or not you would be successful. That's not a real thing. And so patients do go to clinics and they hear the price tag, right? And so then they turn to other sources that are accessible to them. So they go to a clinic. The clinic says, yep, it's going to cost you with meds probably $20,000. You need to do this, 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 and this. You need to have this blood drawn, blah, blah, blah. Oh my Lord, right? So they go home and they grieve, right? Because again, it's been a secret club for a long time. And so I will say, thank you, President Trump. Thank you, Senator Britt, and thank you every single one of you in the federal government that are cheering for IVF because you understand that it is the solution needed for many people. So I will never mince words on that. We are so into putting people in one box or another, instead of saying, you know what, that's a good thing. That's a good thing, right? So, but as I was saying, patients turn to influencers, and that's something new, right? Influencers weren't a thing when we were kids. The
No.
influencers was like Teen Magazine or something like that. I don't remember, but now there's all of these sources where people can go for fertility guidance instead of just reproductive endocrinologists, right? Which are fertility doctors. But the danger now is truly not just financial. And I want to reiterate that has been the problem for a very long time. And that still, within the lack of details, continues to be the problem. But we now have more of like an existential concern because, as we've said, it's like one moment they're saying that IVF is unnatural and unethical, and then on the next that it's the greatest thing since sliced bread. So to me, that feels kind of existential in a way.
Yeah, it's like there's three converging crises, right? It's misinformation, ideology,
Yep.
economics. So, I know, we're already starting to unpack all of that. So, like you had mentioned misinformation. It's that on social media, the pseudoscience is coming out of it. There are some things that always pop up in my feed just because of, obviously it's heavy on the fertility things. So things just pop up into my social media all the time. And I'm just like, what is this? But, secondly, the ideological interference, we're seeing state legislators and courts, and they're trying to define, we were talking earlier about how embryos are persons, the personhood, which would literally criminalize basic embryology practices.
Yeah. I mean, and as we said, we're not focused on the actual problem. You're making a
Hmm.
new problem. 8 out of 10 Americans think IVF should be accessible. So instead of legislating the actual problems, instead we legislating solutions, that we're legislating problems, right? And then you add the economic barriers where fertility has become, not has become, I mean, I think fertility care has been up until this point a privilege when it should be a public health right. And together, I think these crises feed each other. When misinformation spreads, ideology thrives because that's how it takes root. And then when ideology starts to thrive, you see policy regressing. And that's what I think we're seeing right now unfold before us is it's starting to regress. There's not a really true, clear plan that is rooted in evidence based medicine. And thus, patients pay the price. And that's the piece that keeps me up at night.
Yeah, I mean, and behind all of this, it's just people who want to start a family. It's not abstract. It's normal people. They just want to have a family.
Yep. And
So they're
yeah, yeah, it is. And you talk to, and that was one of the things that I would, we mentioned that the briefing, the RRM briefing did really well and likely better than us is highlighting those patient stories because stories really are the currency that will help sway and persuade folks back to sort of more of a fact-based algorithm and less of a misinformation-based algorithm. And as you said, it's not abstract. I mean, we've both had patients who lost embryos to restrictive laws. We've both had patients, many patients, hundreds of patients. I would say for myself, thousands of patients over 5 years at a clinic that was primarily a travel-based program. People are driving across state lines, flying across the country to get access to a fertility doctor. I mean, if you told a man that he had to go 4 hours to see a dentist or to get his ED meds, it would be a national incident. And every single day, and we talked
Yeah.
about it earlier, right? Nurses, firefighters, frontline workers, we're not very kind to people when it comes to things like time off and those sorts of things, right? So it's insanity, honestly, to think that this is just how it's going to be, right? So, but when reproductive care becomes political theater, which is exactly what I think you and I are both seeing and saying and feeling, that this reproductive care has fallen into this theater zone. And as such, I mean, we can even point to the fact that, not long after I was on the Hill, hearing about RRM and advocating for evidence-based medicine, it was not long after that the FDA approved approved a generic of mifepristone, which is a great thing for reproductive autonomy. It's also completely like in it's in a so that's what we say is the political theater is what we're seeing, and that very theater is causing families to lose years of their life, friends, like years of their life waiting on a promise that may never come or saving for a cycle they may never even be able to save up enough money to do. Like, and RRM, like, I have this saying, it's like when ideology dresses up as medicine, that gets really confusing because it's often marketed as natural or moral or holistic. But when you peel back the layers, it's literally just ideology wrapped in a lab coat. It's like a wolf in sheep's clothing.
Yeah, I mean, like you said earlier, we've seen patients go through that. They waited years to come into a fertility clinic, or we see them there, but they're like, I want to do this the most natural way possible. When as the providers, we know like this isn't going to work out, but of course, we're going to do what the patient wants. They need to have that autonomy to make those decisions. We can only give them information. We cannot make their decision for them. So if they view IVF as unethical, first off, I'm like, that breaks my heart when someone says that. But it is their choice, and I'm all for choice. And if they want to do it in a more natural way, okay, but we have given you the information, but they're absolutely have that
Yeah,
autonomy to make
I
decisions.
liken this sort of dichotomy to that of a Jehovah's Witness.
Mhm.
Jehovah's Witnesses do not accept blood products. So if you have a patient, I've had multiple postpartum patients that were Jehovah's Witnesses who we had to cover the fact that if you have a postpartum hemorrhage, you understand that it could be that giving you blood would be the thing to save your life. You understand and that's what you're declining, not, well, what are you even thinking? I mean, you need to take this blood because that's not what nurses do. It's not what medical providers do, not good ones. And it's also
Yeah.
important to note that I think, leaning into a couple of horror stories from an IVF clinic does not paint the whole picture. We've all had horror stories. I have had a horror story not practically, probably in every single specialty of medicine across my lifetime of medical issues. you know it doesn't it yeah, it's just one of those things that it is heartbreaking because we are relying on, in that case, if they are told that it's unethical, and again, there as nurses, we're not going to force you, we're not going to try to convince you. Again, we give you the
Yeah. No
facts, and
judgment.
then we empower you to make the choice that's right for you. But we've got RRM, they're relying on things like outdated diagnostics that don't have peer reviewed validation. The American Society for Reproductive Medicine is a very long standing and well respected and well recognized medical society. If there were something that would make it easier, faster, and cheaper for our patients, I guarantee you ASRM would check the box, right? So, and it often positions
Absolutely.
evidence based treatments like IVF as immoral. And that's not helpful, right? I don't say to a patient who says, Jehovah's Witness, like, I don't say it's immoral. You're gonna let your other child grow up without a mother, because that is not what we do. It's not what
No.
we do. And that's what folks need to understand, is that we are defenders of choice. So if your choice is to see IVF as unethical, whilst again, that doesn't resonate with the way we see it, we will never try to push it.
Right. And I
Sorry, got a
think
little
that
fired
it's
up,
the other
but
yeah, I can tell you slapped down the 10. You're on it.
no,
But,
it's just so frustrating when, and you've seen these cases where patients have been sort of guilted into things, but I need the overarching message to stay clear and not get clouded by this theater that's taking place,
Mhm.
and to just sort of like snap everybody out of it and remind you, like, there is a place where we can coexist with different beliefs.
Exactly. And, for one side to say, "Oh, that's immoral." We're not saying that you're immoral for, keeping IVF from people. And that's where I'm going to leave it at that. But let's talk about some economics again. Because it's not exactly separate from ethics.
It's not. It's absolutely not, AnnMarie. I mean, we talked about this a little bit earlier, but fertility drugs that have existed for decades still cost thousands of dollars per cycle. And I really want people to understand this, okay? I'm talking about $300 for one dose of one shot. And I know that because I remember buying all my fertility drugs. And every morning before I went to work and I shot myself up with Menopur, I was like, there went $150. One shot, $150. That's just the morning shot. Tonight's 300 units of Gonal-F cost me $300. So I just injected myself with meds that cost me $450 for one single day. Most meds are taken for around 10 to 12 days. Okay. So patent manipulation, and this is what my congressional testimony that I wrote last year was aimed to discuss, was that patent manipulation is keeping generic drugs off the market. And then you've got biosimilars that are stuck in bureaucratic limbo. And listen, maybe EMD Serono joining with this administration's efforts to lower the cost of prescription drugs, maybe that will be the thing that will finally get patent manipulation off the table and get bureaucratic limbo off the table. I really, truly, truly hope that that is the case.
Yeah, yeah. And the people that are everyone is affected. Everyone.
Mhm.
And the people that are hit hardest, those are working class families that are just trying to have a family. We have our single parents, one person paying for all of that. You have your LGBTQ plus community, couples, cancer survivors, all these different people that have, I'm not saying that they deserve more discount or anything like that. What I'm saying is they have to shoulder it more than
Right.
other people,
Yeah, because a
you know.
$300 injection is completely unaccessible to a large portion of people. Like
Yeah.
it or not, I am grateful for the privilege that I had to be able to afford that, to weather that storm. But your point is so well taken, and that is that the people who are hit the hardest by this type of nonsense are the ones that hurt the most from it. Because if you don't change the price of drugs, there's fertility drugs, there's still a certain populace of people that won't affect. They'll still be able to get access to it. But when people have to then choose between paying their rent and paying their fertility meds, I mean, at that point, we've really abandoned do no harm. And I remember many, many conversations when I was an active clinic fertility nurse. My desk actually used to sit on that wall behind me all during the pandemic. I sat back there and I talked to dozens and dozens of patients a day, 5 days a week, for 5 straight years. And it was an overarching theme. I would say, listen, your eggs, your ovaries, your follicles, they're not quite ready yet. I know we said we would probably need 10 days of meds. You're gonna need like 3 more days of meds. Well, Elizabeth, I maxed out my credit card on the first round. Like, these are real stories. These are real lives and real stories of people. I've mentioned before, I think on this show, a very close friend of mine, $150,000 and still never had a baby to I mean, those are the stories I, in fact, ran into at a wonderful sort of living room lecture event that I went to yesterday. I ran into an old patient couple that I had taken care of. I looked at her, I was like, I know you. And she's like, "Huh." I'm like, I think I do. And like 3 minutes in, I was like, now I know where I know you from. And they ended up, they were not successful, and when she said, we didn't have success and we're okay with that, we're moving on, felt that heaviness because that is not, I mean, it's as great as advances as we've made, IVF is still not a slam dunk. And that is when profit motives replace patient motives. That's just, it's unacceptable. And it's why you and I do what we do, right?
Yeah. I mean, I think, every fertility nurse that has to make that call of one more day or, hey, a couple more days, and what do you have left? And let's try to figure out how we can combine cartridges,
Yeah.
to make you a dose
Yeah. Or
or,
see, do we have
anything.
like a sample, an extra
Mhm.
or a donation? Sometimes patients would end their cycle or something would happen. Do we happen to have one more dose? Does anybody have a dose of meds? I mean, I remember one night late at night, I got a call from a donor and she didn't have her trigger Lupron. And
Oh
I just
god.
happened to have just picked up my trigger Lupron for my cycle, but I didn't. No, I don't think mine was the trigger. Mine was like downregulation Lupron for my frozen embryo transfer cycle. And so I didn't need it just yet. And so I called our doc and I was like, hey, you know, here's the situation. I happen to have this untouched dose, like, and, got a written order for him to, allow that to happen. But that's the reality is this is like a day-to-day thing. And when you have to call and say like, yeah, you need more meds, it's truly sad to, rate the cost of raising a family is really, really expensive. We really talk much about that, but daycare, diapers and all the things. I mean, it's very, very, very expensive. And what we're doing is we're essentially bankrupting people just to get the kid, right? And we're
Before that
wiping
even
out,
happened.
yeah, and we're wiping out like generational wealth because we know. So yeah. So and we don't stop at looking at what the problems are because I think a lot of our listeners are like, yeah, we know what the problems are, right? But there are real actionable solutions that are entirely achievable if we act with urgency, entirely
Yeah.
achievable.
Tell us, Elizabeth. Give it to us.
Well, I mean, first is regulatory reform, right? We've got to streamline FDA pathways for reproductive hormone biosimilar meds and have transparency around patent extensions. So that's one thing that is entirely achievable. And this administration says that they want to hold big pharma accountable, that they want to bring down the cost of drugs. So do we. Let's work together. Second is coverage expansion. So fertility care should be covered just like any other essential health care. Period. Full stop. Employers and legislators need to stop treating this like an elective thing. When we had to tell people during the beginning of COVID that we couldn't do any IVF because it was considered elective, that was a heartbreaking thing because to these patients, it is not elective. And the third thing we
No,
can
it is.
do is have market accountability. Companies should publicly disclose their R&D costs, their pricing methods, and so patients and policymakers can actually see what's real versus what's inflated. I mean, those are three very actionable things that we could work together and make happen.
Yeah, absolutely. They're all practical. Like, wow, practicality. Let's bring it back. We want to need practicality. That needs to cut across the politics. At the end of the day, family building, it's not partisan. It's not one side of the aisle or the other. It's human.
Exactly. And at the end of the day, yeah, having a family is really an instinct or a desire of, I'd say, a decent majority of people. There are certainly people who don't have the desire, and that should be supported. But at the end of the day, family building is truly a human. I mean, we exist because of family building. And
Yeah.
then, when we shift into how do you defend evidence in what is effectively like a post-truth era, if that makes sense. But science doesn't defend itself, you guys. People do.
Hmm.
That's our responsibility as nurses, doctors, embryologists, advocates, administrators, anything and everything. It is our responsibility as people who fight for this care. It's our responsibility to defend the science,
Absolutely.
right?
I mean, that's why we're here. I mean, that's why we started this podcast. That's why our conversations were essentially a podcast. And it was just why we started this, which is, the birth of the Repro files was, it is our responsibility as nurses,
Yeah.
and as advocates, so, what do we tell people? How do we push back?
Well, we do, you and I, like you said, we've formed a podcast. Don't we have stickers now? Didn't you tell me, aren't the new stickers coming out? What? Those of y'all that will be at ASRM, there's going to be some fun stickers floating around. But
We got
the
good.
Reprofiles podcast, the birth of the Reprofiles podcast was truly to help pull the veil back, educate early, educate often, advocate for fertility literacy to start in the primary care setting and the public health setting and not once we have a problem, right? Instead, why don't we educate early and often so that folks can recognize a problem sooner and do something about it sooner? We unify our language across ASRM and SART and our allied organizations. And then we have to engage policymakers, not like we're lobbyists, but always and ever reminding that we are experts in this field, but that we come with both data and empathy. It's not an either or, it's
Absolutely.
both.
It's both. Empathy is not a bad word. It's a very good word. And that's what I'm going to say about that. But that's how we are going to rebuild trust. It's through clarity, through consistency, through courage. It's the 3 C's we're
I
going to
love
be
it.
doing. Clarity, consistency, and courage.
Yeah.
But let's bring it back to the people that are at the heart of this. Like the
Yeah.
everyday people.
Yeah, like we said, I mean, every day thousands of families do drain their savings accounts, sell assets, drain their 401k accounts. I mean, they keep going. And that's at one shot of IVF. And I will never forget this young woman that was about 25 years old and she had kind of a double whammy. I think her tubes were damaged, but then I think her husband also had a retrograde ejaculation or some sort of there were 2 factors, right? And it was, the best chance we would have would be to do IVF and bank some embryos. And long story short, that patient borrowed $25,000 from her father and it didn't work. She wasn't successful.
Yep.
And, these patients, they do not want your pity. They don't.
Nope.
They want fairness. They want everyone to have the same access without judgment and most certainly without financial devastation.
Yeah, these are stories we hear literally every day. I currently know someone going through IVF. They are about to start their 3rd round. Young person, no embryos yet. Like, this is the type of stories. It's those stories that drives me, and I know it drives you as well.
Yep. Yep.
Data matters, but humanity is what is going to change policy. Those stories, and we've said this before, it's those personal stories that have to get out there. And the people that have the courage to go out there and tell their stories.
Yep.
This is how we are going to make change.
You got it. You got it. Here's our call to action, my call to action. We cannot let ideology define the boundaries of science. Okay, we have to define them ourselves with compassion and clarity and courage, like you said, and with evidence that supports what we are touting. Because otherwise, as we said earlier, we have failed on our promise to do no harm.
Yeah. And we're going to be bringing this message and your full paper to
Woo,
ASRM
yeah.
2025
Yes,
in San
that's right.
Antonio next week.
That's right. That's right. We'll be recording our next episode together. And we're really excited. If you're going to be at ASRM, please, please, please make sure you find one of us, come say hi, grab a sticker, and tell us your story. AnnMarie is going to be very busy on the conference floor, just trying to collect stories, right? Because again, patient stories are the currency that is going to move the needle. And so we would love to have you come tell us your story.
Absolutely. Oh, and you forgot, we got to talk about Cuterus. Cuterus
Oh,
is going to make an appearance.
That's right. So Cuterus she's had some procedures done, but
Yeah.
she's now going to be a receptacle for question and answer time on the conference floor. So stay tuned for Cuterus and her her second debut, I guess we'll say.
Yeah. So if you want to answer a question for us on the floor, come
Yep.
find us in Cuterus. Until then, remember the future of reproductive medicine has to be guided not by fear, but by fact.
Yep. Not by ideology, guys, by evidence. And most
Yes.
importantly, not by silence, but by strength. So we will see you from San Antonio next time. Thank you for your support, for liking, for sharing, for commenting, and we'll see you soon.